Let's jump right into this gentle explainer designed to really help you and your family understand the journey of knee osteoarthritis, and more importantly, the empowering steps you can take for your daily comfort. Whether you're dealing with a little bit of morning stiffness yourself, or maybe you're a caregiver trying to help a loved one navigate their day, you are in the exact right place. We're going to completely demystify what's going on inside your knee and give you real actionable tools to improve your overall quality of life. To keep things organized today, we're going to walk through 6 clear steps. We'll cover everything from the basic anatomy and the stages of wear and tear, all the way to daily care and treatment options. Knowing what to expect really takes the fear out of the process, so let's get into it. Section 1. What is knee osteoarthritis? We'll start by looking at the basic anatomy of your knee. Think of the ends of your bones like 2 hard stones. In a normal, healthy knee, those stones are covered with a thick, smooth, protective cushion called cartilage, and that's what allows for completely pain-free movement. But when osteoarthritis occurs, it's kind of like that smooth cushion starts to fray and wear down. As the cartilage breaks down, the space between the bones physically narrows, and without that smooth glide, your knee feels stiff, it swells up, and it hurts when you walk. Okay, so a crucial part of this is translating the medical jargon you might hear from your doctor into plain English. You might see the word osteophytes on an X-ray report. That simply means bone spurs. Think of them as tiny, bony speed bumps your body naturally creates in response to the joint stress. You might also hear the word sclerosis. Sclerosis just refers to an area where the bone right beneath that wearing cartilage gets thicker and denser. It's almost like your bone is trying to build up a callus to protect itself. Moving on to Section 2, the early stages, which doctors refer to as grades 0 and 1. We always start with a healthy baseline, a grade 0 knee. On an X-ray, the bones have perfectly smooth contours, and there's plenty of dark, empty-looking space between them, which is exactly where the healthy, invisible cartilage lives. At this stage, our focus is purely on prevention. We want to maintain muscle strength, promote flexibility, and encourage regular, safe physical activity to protect the joint. Honestly, this is a great time to start a simple, daily activity tracker, just to build those positive movement habits early on. As we move to grade 1, we start to see how this builds. There might be a very slight, questionable narrowing of that joint space. The X-ray might show what doctors call doubtful changes, like maybe a tiny hint of a bone spur forming. You might just feel a faint ache after a really long walk. This is the absolute perfect time to stay active with low-impact exercises, think swimming or riding a stationary bike, and to manage the load on your joints through balanced nutrition and staying well hydrated. Starting a really simple pain log right now can also help you track any of those faint aches over time. Section 3, mild to moderate changes, or grades 2 and 3. As we progress, the symptoms become a bit more noticeable. But remember, we always have actionable steps we can take. At grade 2, which is categorized as mild osteoarthritis, definite bone spurs start to develop at the edges of the joint. You might start feeling intermittent pain or stiffness, especially when you first wake up in the morning. For caregivers, this is where you can really help encourage a daily routine of gentle walking. But remember, you've got to practice self-care to avoid caregiver burnout too. Targeted exercises to strengthen the quadriceps, the hips, and the core are vital here. They act like shock absorbers to take the pressure right off the knee itself. Now at grade 3, we enter moderate osteoarthritis. The joint space is obviously narrowed, and you'll see bright white areas of sclerosis, where the bone is getting denser. At this point, you might feel pain that actually limits your daily activities. And it's totally normal to feel a bit emotionally frustrated at this stage. It's so important to be kind to yourself. Incorporating therapeutic exercises specifically designed by a physical therapist to improve your mobility and functional movement is key here. Managing pain and stiffness really becomes a daily priority. Section 4, severe knee osteoarthritis, known as grade 4. If you're at this stage, don't panic. Understanding it just helps us get you the right support. In a grade 4 knee, the cartilage is markedly reduced to near bone-on-bone. The bones themselves might even start to change shape, which can actually alter your leg alignment a bit, perhaps making you look a little bow-legged. This level definitely brings persistent pain and a real reduction in your mobility. But again, conservative management, like proper pain control, using mobility aids around the house, and focusing on safe movements to prevent falls can still provide a ton of symptom relief while you sit down with your doctor to discuss surgical options. Thinking about this entire progression chronologically really shows that wear and tear is a gradual, step-by-step journey. It definitely doesn't happen overnight. And more importantly, it shows us that there are clear, effective interventions available at every single stage to keep you moving safely and comfortably.
Section 5. Daily Care and Management. What are the conservative steps you can take at every stage?
So these 5 actionable steps are basically your core daily toolkit. First up, exercise and strengthening. Even gentle, safe movement helps. Second, weight management through wholesome foods and hydration lightens the physical load on your knee. Third, medications. Maybe set up a simple daily pill organizer so you stay right on track. Fourth, utilizing braces and non-medication comfort techniques like ice or heat. And fifth, physical therapy to actively improve your balance. Family members can be a massive help here by ensuring the pathways around the house are clear of tripping hazards and just offering encouragement on the days when those exercises feel tough. Section 6. Considering a knee replacement and knowing when it's time to take that step. Let's ask a really common, very important question. How do you actually know when it's time to talk to your doctor about replacing the joint entirely? It is a big decision for sure, but knowing the signs takes all the guesswork out of it. First, let's demystify the surgery itself. During a total knee replacement, the damaged, worn-out surfaces of the bone and cartilage are carefully removed and replaced with beautifully engineered artificial components. The whole goal is simple: relieve your severe pain and vastly improve your mobility. This is a brilliant time to bring a prepared list of questions to your doctor's appointment, so you know exactly what your specific recovery timeline and your milestones will look like. But when do you actually make the call? Well, if you're experiencing severe pain that limits your normal daily activities, if you have significant difficulties simply walking or climbing the stairs despite giving physical therapy your best shot, or, and this is a huge one, if you are experiencing pain that wakes you up at night, even when you're using comfort techniques like a supportive knee pillow. When your overall quality of life is taking a hit despite doing all the conservative steps we discussed, and your x-rays show advanced osteoarthritis, it is absolutely time to sit down with your doctor and discuss a total knee replacement. We're going to end on this incredibly empowering thought from our source material. Early evaluation and proper management can slow progression and improve outcomes. Your mobility, your independence, our goal. Please, don't wait until the pain is unbearable to ask for help. So what is one gentle step you can take today? Maybe it's just calling to schedule an evaluation with a skilled physical therapist, or setting up a daily walking tracker to protect your joint and your independence. Thank you so much for exploring this explainer with me, and take really good care of those knees.